Welcome to this informational video. This video aims to introduce you to cancer treatment and give you a general overview of what to expect during your treatment journey. We recognize that a cancer diagnosis can be both overwhelming and frightening. The worries about your health combined with the logistical challenges of treatment can seem daunting. However, you are not alone on this journey. At Ironwood, we are committed to guiding you through every step with confidence and peace of mind. Just as the resilient ironwood tree thrives in the Sonoran Desert, Ironwood Cancer and Research Centers embodies hope, strength, and support as you or your loved one navigates the personal journey of battling cancer. At Ironwood Cancer and Research Centers, we have a variety of team members and supportive care services available to assist you with the many facets of cancer care and treatment. Oncologist oversees your cancer treatment plan. They decide on the regimen, adjust doses, and determine if delays or changes are necessary. Oncology nurse administers your infusions or injection therapies and provides hands-on support throughout treatment. Medical assistant provides direct assistance to oncologists and nurses in delivering care. Office staff creates a positive, welcoming environment while managing important administrative tasks including scheduling. Benefits coordinators help you navigate the complex world of insurance, financial resources, and benefits. Supportive care services. Ironwood provides a wide variety of wellness classes, support groups, events, and resources. These include nutrition, social work, genetic testing, and integrative oncology services available at our various centers. Your nurse will provide you with an Ironwood bag, which includes a few items, such as your chemotherapy resource guide and a folder with information about the various services and support we offer. Within the resource guide, you'll find essential information about chemotherapy treatment and helpful tips to support you throughout your treatment. Before we delve deeper, let's start by discussing cancer in general. With so much information and misinformation about cancer, it's important to understand the basics. Cancer is caused by the uncontrolled growth of abnormal cells in the body. While not all cancers are heritable, they all have a genetic component because cancer results from mutations in DNA. These abnormal cells are smart and can continue to grow and spread to other parts of the body, a process known as metastasis. When cancer is discovered, it's often due to noticeable changes in your body or abnormalities found on a scan. You might have experienced unusual symptoms that prompted you to visit your doctor for further testing. This testing typically includes imaging, such as a CT scan. For example, a lump in the breast may lead to a mammogram and, if necessary, a biopsy to confirm the diagnosis. A pathologist examines the biopsy sample to determine if cancerous cells are present. If cancer is found, additional tests may be conducted to identify the type and check for specific markers. These results help determine potential treatment options. Once all the information is gathered, your oncologist will work with you to create a personalized treatment plan. This plan may include surgery, IV treatment, oral therapy, radiation, a combination of these treatments. Your doctor's recommendations are based on extensive research and data, carefully tailored to your specific case. Now, let's discuss the three main types of therapies used in cancer treatment: chemotherapy, immunotherapy, and targeted therapy. Chemotherapy is the traditional cancer treatment that uses drugs to kill rapidly dividing cells in the body, including cancer cells. Chemotherapy doesn't specifically target cancer cells and can also affect healthy cells that divide quickly, such as those in the hair follicles, digestive tract, and bone marrow, leading to side effects like hair loss, nausea, and a weakened immune system. Immunotherapy boosts or manipulates the body's own immune system to recognize and attack cancer cells. Instead of directly attacking the cancer itself, immunotherapy helps the immune system better identify and destroy cancer cells. Targeted therapy targets specific molecules or pathways in cancer cells that are involved in their growth, survival, or spread. It is more precise than chemotherapy because it focuses on the cancer cells while leaving most healthy cells alone. Your treatment may involve one or a combination of these therapies, administered through IV, oral medication, or injections, depending on your specific needs. During your education, a nurse will review the specific medications you will receive for your treatment. Your treatment can be administered in various ways. Typically, when you come in for your treatment, you will receive IV therapy through a vein in your arm or a portacath. A portacath is a venous access device placed surgically under the skin in your chest. Treatments can also be delivered by injection or orally. The method of administration will depend on the type of treatment you need and the type of cancer you have. What are some important topics to discuss with your doctor or nurse before starting your therapy? It's important to discuss your complete medical history, including any heart or lung diseases, with your doctor. This information is crucial as it may require modifications to your treatment plan to help prevent serious organ damage. It is important to provide your doctor with a current and comprehensive list of all medications you're taking, including over-the-counter and homeopathic remedies. If you are prescribed any new medications by another provider or if your current medications are modified in any way during treatment, please inform your oncologist. At various points during your treatment, you will undergo genetic testing or tumor analysis to examine the genetic makeup of your cancer cells. This testing involves taking a small sample of bodily fluid or tissue, such as blood, saliva, cheek cells, or tumor, for lab analysis. This helps your doctor understand the genetic mutations driving your specific cancer, which in turn can guide treatment management, determine prognosis, assess the risk of recurrence, evaluate family risk, and determine eligibility for clinical trials. As your doctor reviews your treatment plan with you, you might wonder, how do they determine the appropriate dose of medication and its frequency? Treatment plans, including dosing and frequency, are based on many years of research studies and typically consider factors such as your age, weight, height, gender, and lab values both before and during your chemotherapy regimen. This is why it's crucial to have your routine labs drawn before your treatment. Speaking of labs, there are several reasons why it's important to get your labs drawn as ordered. It provides us with a basic snapshot of your body's tolerance to the medications. We'll check your kidney and liver function, as these organs play significant roles in metabolizing and eliminating drugs from your body. Additionally, we'll monitor your overall blood counts to ensure that your dosing is safe for you. When you arrive for treatment, you'll check in at the front desk or through our automated system, kiosk, and wait to be called. One of our MAs or RNs will either bring you into an exam room to see your oncologist or you will be taken directly to the infusion suite. Your vitals and weight will be taken before each treatment. Your vitals include your blood pressure, oxygen level, temperature, and your heart rate. Your height will be measured only on day 1 of treatment. Your vitals and weight are taken before each treatment. Tell us a little about how your body is tolerating the treatment. For example, an increased heart rate and decreased blood pressure can sometimes indicate dehydration. Once you're in the infusion suite, your nurse will review your vitals, check your labs, and ensure everything is in order for your treatment that day. We encourage you to communicate any symptoms or side effects you may be experiencing, as your safety is our priority. Sometimes, the dosing needs to be adjusted, or a treatment may need to be delayed to manage an issue or give your body more time to recover. This is not uncommon. A short delay, ranging from days to a couple of weeks, generally does not significantly affect the overall outcome. Once the nurse has completed an assessment and you both feel confident about proceeding with the treatment for that day, your nurse will start an IV in your arm or access your portacath. After your line has been accessed, your nurse may ask if you would like a warm blanket, a pillow, a snack, or a drink. They will show you how to recline your chair and where the restrooms are. Once you are comfortable and oriented, the nurse will return to the nurse's station to print out your orders and give them to the on-site pharmacy. The pharmacy will then verify that the drugs in your order match what was prescribed. After a second RN double-checks the dosing calculations, frequency, labs, and vitals, the drug is reconstituted by the pharmacy techs. If your treatment requires it, your nurse will start by administering your pre-medication. Pre-medication is given before chemotherapy to help manage and prevent potential side effects or reactions. Some pre-medications help prevent nausea and vomiting, others prevent allergic or hypersensitivity reactions, some protect specific organs, and there are even pre-meds that can help with restlessness and anxiety. After your pre-medication is completed, your therapy will be infused. Some regimens include only one medication, while others may have 4 or 5. Sometimes you will need to return the next day, come for multiple days in a row, or go home with a continuous infusion pump that continues to deliver your chemotherapy. Your nurse will go over your specific regimen with you. It's important to note that some chemotherapy and immunotherapy treatments are administered via injection rather than IV. Some injections will require you to take oral pre-medications at home before arriving for your injection. Be sure to review your treatment plan closely and clarify any details with your RN during your education. Any medication can cause hypersensitivity or allergic reactions. Therefore, it's crucial to inform a member of the infusion team immediately if you start to feel unusual at any point during your infusion. This includes symptoms like sudden flushing, chills, dizziness, new rashes, coughing, or pain. The sooner we are alerted, the faster we can manage and resolve your symptoms. When coming in for treatment, dress comfortably, especially if you have a long session ahead. Feel free to bring items to keep yourself occupied, such as an iPad, cell phone, books, or crossword puzzles. We also have donated books and magazines available, and on days when volunteers are present, they will bring around a cart with various distraction goodies. If you bring a device to watch or listen to media, we ask that please be considerate of others and use headphones or earbuds. To minimize the risk of infection for our patients, we limit access to the treatment room to patients and essential personnel only. If a loved one accompanies you to your doctor's visit, we ask that they wait in the waiting room or leave the facility after escorting you to the infusion room. Exceptions are made for patients who need assistance with bathroom visits or have confusion or communication needs. Children under the age of 12 are not permitted in the infusion suite at any time. We recommend arranging a ride to and from the clinic for your first infusion, as many treatments can cause drowsiness. During your education, a nurse will go over some of the most common side effects associated with your specific treatment. It's important to remember that not all of the side effects mentioned will necessarily occur in your case. The most common and often persistent side effect to all cancer treatments is fatigue. Managing fatigue involves balancing rest and gentle exercise, along with proper nutrition and hydration. Treatments can also affect your gastrointestinal system, potentially causing side effects like heartburn, nausea, vomiting, diarrhea, or constipation. Many of these can be prevented or managed with diet and over-the-counter or prescription medications. For many of our chemotherapy regimens, supportive medications are sent to your pharmacy before your treatment starts. Please ensure you pick them up 1 to 2 days before your treatment. Instructions for their use will be listed on the bottle and in your information packet. Generalized aches and pains can also be a relatively common side effect. Sometimes, these can be managed with over-the-counter medications. However, it's important to inform your doctor if the pain persists, so they can help you manage it effectively. Neuropathy, which is numbness and or tingling in your hands and or feet, can be a side effect of some chemotherapies. It's important to discuss neuropathy with your doctor, as it may indicate that the dosage of your therapy needs to be adjusted. There are over-the-counter and prescription medications, as well as creams, that can help manage discomfort. Cold therapy or cryotherapy, which involves using cold packs on the hands and feet, can also be used to prevent or reduce neuropathy during chemotherapy by limiting the amount of chemotherapy that reaches the nerves in these areas. Some treatments can cause skin or nail changes, such as rashes, discoloration of the hands and feet, darkening of the nail bed, lifting of the nail from the nail bed, and increased skin sensitivity to sunlight. Many therapies make your skin more sensitive to the sun, so be sure to cover up and use sunscreen when going outside. If you experience any skin symptoms, inform your nursing staff or doctors promptly, as some skin conditions can worsen without treatment. Chemotherapy can impact your bone marrow's ability to produce cells, including white cells, red cells, and platelets. This can lead to lower cell counts in your blood. It's crucial to have your blood levels checked at the lab before each infusion treatment. Your healthcare team will carefully review these levels to ensure they are not too low to safely administer chemotherapy. If your counts are too low, your treatment may be delayed by a week or so to allow your body time to recover before the next infusion. Symptoms of low blood counts include excessive fatigue, easy bruising, nosebleeds, bleeding gums when brushing your teeth, blood in your urine or stool, and the most concerning symptom, fever. If you experience any unusual or concerning symptoms, including a temperature of 100.4 degrees Fahrenheit or higher, notify your healthcare team immediately. An elevated temperature can indicate an infection due to low white cell counts. Other symptoms of infection include a sore throat, runny nose, and cough. Additionally, if you have an incision or wound that isn't healing, appears red, or has white pus-like drainage, this could also signal an infection. Be sure to inform your doctor or nurse if you have any of these issues before your next therapy session. Stay safe and well at home. Avoid unnecessary trips to the hospital. In your informational packet, you will receive a Call Us First card. This card lists side effects that, if experienced, should prompt you to contact your healthcare provider on the phone number listed on the card. Some quick do's and don'ts to keep in mind during your treatment. Eat small, frequent meals. Avoid spicy foods and raw meats. Hydration. Drink 6 to 8 glasses of water, juice, or sports drinks daily. Avoid alcohol and limit caffeine. Wash your hands often, use soft bristled toothbrushes. Protect your skin from the sun with sunscreen, hats, and sunglasses. Keep up with light exercise. Listen to your body and rest when needed. Avoid exposure to sick people. If necessary, wear a mask in crowded areas. Ironwood Cancer and Research Centers supportive care services include individual consultations for nutrition, genetics, and integrative oncology. They can also assist with insurance and disability applications, and transportation and financial resources. You can find a supportive care services calendar online at our website by clicking the calendar icon at www.ironwoodcrc.com or scan the QR code on your screen. During your treatment at Ironwood Cancer and Research Centers, your doctor might suggest participating in a clinical trial. The doctor and research staff will thoroughly review the trial with you and address all your questions before you decide. Participation is completely voluntary. If you're interested in joining a clinical trial, ask your physician if you qualify for any of our current studies. We are grateful to be part of your journey. We understand that this video covered a lot of information. For your convenience, you can find this video and the chemotherapy resource guide on our website under patient forms and information. Alternatively, you can scan the QR code displayed on your screen. Your nurse will be available to address any questions or concerns you may have.